This video was supported by the Australian Government through its Wildlife Rescue and Rehabilitation Initiative and the Foundation for National Parks and Wildlife. Hi, I'm Dr. Bree Talbot, Foundation Vet for the Byron Bay Wildlife Hospital, and helping me today we have vet nurse Hayley. And we're going to be showing you how to handle and assess seabirds in the veterinary practice. The type of seabirds that you may encounter in your practice are typically going to be your silver gulls, your pelicans, and your shearwaters or petrels. A lot of these birds will come in with either fishing hooks wrapped around their beaks or fishing line wrapped around their legs. They may come in because they've been attacked by domestic animals, or they may come in because of exhaustion. So today, helping us with our examination is Effie the petrel. Now, your clinical examination for a seabird is going to be much like that of a normal terrestrial bird. The only difference is going to be the species and whether or not they have internal or external nares. So your shearwaters, your petrels, and your silver gulls, they do have either external or partially external nares, whereas your pelicans are going to have internal nares and have to breathe from the sides of their mouth. So holding their beaks is going to be a little bit different so that you don't suffocate them or occlude their breathing. With Effie, we can get her out normally. We're not going to hold her chest too tight so that she can still breathe. And if we need to, we can place our hand over her beak just lightly in case we need to check her face without her poking us. So Hayley's going to show you how to get her out. She's in her basket. This is generally how they're going to come into the practice. You're going to put a towel over the top of the bird, covering their head if need be, and gently clasp around each side. She's a good patient there. Well done, Miss Effie. And so you're going to do your physical examination just like you would any other bird. Start from the top, look at the eyes, assess the nostrils, assess the oral cavity, and then assess each of the wings and the legs. With some of your bigger seabirds, so your pelicans or even your cormorants, you may need to actually hold up further in their body and hold their femur so they can't kick you. They can actually be quite strong, and so you want to have control of those legs. But with a smaller seabird like this, simply having the towel around them is enough. So with Effie here, we're going to have a look at her eyes. A lot of your seabirds will have salt glands, and so you may see some discharge coming from the eye or discharge coming from around the actual face area. Don't be too concerned, this is normal, especially if they haven't been out of the water for too long. If you have a cormorant or one of your larger birds with a very long beak, please wear eye protection because they're very good at poking you in the eyes. But with Effie, we can open up her mouth, we can have a look, make sure the papilla looks normal, make sure there's nothing occluding the oral cavity. Especially important if you are concerned if there is a fishing hook down there to have a look in the oral cavity, see if there's any erythema or any bruising or any evidence of an old wound that a hook might have been there and has actually passed further down into the body cavity. A lot of your seabirds, again, will have very long wings and very big wingspan, so be prepared to have a lot of space to get the wings out to have a look at them. One of the most important things that you do need to assess with your seabirds is their waterproofing ability. You want to make sure that their uropedule gland is working, that they can actually waterproof their feathers. We're going to check the leg while we're on the same side. So you actually want to check the webbing. Sometimes they can get infections in the webbing. They can get fishing hooks. So you want to make sure that you've got good blood supply and a nice warm foot. And then we're going to check the other side and repeat the same process again. A lot of your petrels and your shearwaters, they'll actually be quite skinny if they do come into care because they're on their migration path. They'll have quite a prominent keel, so it's very important that you check that before making a decision about the prognosis of what you're going to do with your bird. If they're really, really skinny, that means that they're going to take a lot longer to rehab and get back out, and that might actually change your clinical decision about whether you go forward with them or not. With a lot of your birds, as with your terrestrial birds, it might actually be easier to anaesthetize the bird to assess it. Just be aware with some of your seabirds, especially those ones that are diving for their fish, will have a really prominent diving reflex and can hold their breath for prolonged periods of time. This may affect your anaesthetic induction, and this is something that you need to be aware of and monitor as you're inducing them. So we're now going to anaesthetize Effie. I'm also going to show you a very important part of their anatomy that you have to be aware of when you are intubating a seabird. To anaesthetize a seabird, it's much the same as a normal bird. Place the mask over the face, provide oxygen for several minutes, and then induce with isoflurane. They might have the diving reflex and hold on to their breath. That shouldn't be too much of a problem. You just wait for them to take a breath, and it might just take a little bit longer. As they get anaesthetized, they're going to slowly close their eyes, and that allows you to determine the depth of anesthetic. Ideally, if you can, intubate any bird so that you can maintain a patent airway. If your bird is holding its breath, one little trick that you can do is to massage the keel and move it in and out, and that will encourage breathing and hopefully an intake of the anaesthetic. If you are going to intubate your seabird, one of the considerations that must be taken into account is when you're looking at the glottis, there is a small cartilaginous projection that comes from the ventral aspect. Now this can get easily irritated and can bleed, so it's important that you choose an uncuffed ET tube of an appropriate size that is not going to irritate that projection. Otherwise, when you do remove it at the end of your procedure, you may have blood within your tube and you may cause irritation and inflammation, which can result in difficulty breathing. When you're intubating, we're going to be going into the glottis. You can see that there's this small projection coming from the bottom of the entry. You want to slide your ET tube over the top of it, being very gentle and slowly sliding and twirling the ET tube in. Once you pass it, you can safely tape the tube in place. So sometimes they will get irritated by it. You can spray a little bit of lignocaine spray to help you. Once you've placed the tube and you've taped it, then you can start the rest of your physical examination under anaesthetic. As with any other animal, use your normal monitoring equipment such as a pulse ox or just your stethoscope. A capnograph is also really important for these guys too. To take an X-ray of your bird, you place them on the table and we're going to do two views. We're going to do a VD view and we're going to do a lateral view. The main parts that you need to consider when doing these views is to get your bird symmetrical. So the easiest thing to do is to put the wings out, place your tape down on either wing, and then start with your feet. So what you can see we've done is we've taped both wings, we've kept it nice and symmetrical, and we've taped each foot individually, and that's to help keep the spine nice and straight and your pelvis straight. Remember, always include your marker so that you know which side that you're looking at. So for our lateral view, we've placed our bird on its side. We've tried to get them nice and even. We have put tape over both of their wings. Either have the wings superimposed over the top of each other or slightly oblique. With the legs, pull them down. With the leg closest to the table, you pull that one forward and tape it down. And with the top leg, pull it down and back. Remember, always put your marker down and make sure the neck is nice and straight. Appropriate blood collection sites for birds include our external jugular vein that doesn't have the featherless tract region, but you can still find it if you part the feathers. You've got your medial wing vein, also known as your cutaneous ulnar vein. You can also use your medial metatarsal vein or your lateral tarsal vein as well, and that's really easy to get in your larger birds like pelicans. One important tip to remember with your seabirds is they will be paddling and they do have quite a large blood flow to the leg area, so you want to make sure that you hold off that really well before you let it go so that they don't continue to bleed and get a big clot there. The easiest place to give fluids in a seabird is in the inguinal fold region. So if you move this leg up and down, you can see that there is a fold of skin here that's moving over it, and you can place most of your fluids just in the subcutaneous space just there. Remember, don't go too deep with your needle because you may actually go into the coelomic cavity and you could hit an air sac, which can create some issues with respiration. With your birds such as pelicans, they do have a lot of subcutaneous air underneath their skin, and that might make your fluid administration a little bit more difficult, and you might need a few more people to help you give those fluids. As well as giving subcutaneous fluids, another thing that you may have to give is intramuscular injections to your birds. The easiest place to give that in these guys is in the breast muscle. So you find your keel and then you go either side of that bone and then you feel for the most meaty area and then you give your injection just there. While the bird's under anaesthetic, this is a good opportunity to do your ocular exam. So you want to look at the iris, look at the lens, and then go to the posterior chamber and have a look to see whether the pecten is intact or not, and if there's any discharge or anything stuck in there. So while your bird is under anaesthetic, this is a good time to weigh it because you're going to get a nice, correct weight of the bird. If your bird requires euthanasia, it is best done under anaesthetic. This decreases stress but also increases your chance of getting a nice IV injection site. We can use any of the sites mentioned before for our IV blood collection, But I find the easiest to use for euthanasia is this wing vein. It's a nice big vein, it's easy to get, and if you don't get that one first off, you've got the other one and you've got others to use. If your IV access points are not available to you, you can go into cardiac, but please only do this under anaesthetic and only do this if you don't have any other places to go. Once you have finished all your procedures and you're ready to wake your bird up, we like to place a towel underneath their body with the front end elevated, and this helps to keep their head up so they don't regurgitate. And you can do this for all of your birds, your terrestrial birds as well. Turn off your isoflurane, flash out your system so that you've got fresh oxygen, and then monitor them for fluttering of the eyes and shaking of the body. And that will give you an indication that they're about to wake up. You don't want to keep the tube in there too long in case they do bite it and they cause irritation, especially to that little projection in the glottis. So we're going to hold Effie together like this. We're going to take her off isoflurane and then just let her wake up and place her into her carrier to let her continue her recovery. So once you have woken your bird up from anaesthetic, you can pop it back into its carrier case, just like your normal terrestrial birds. You can set up a towel with a donut inside. You can place the bird in, making sure that you're taking the weight off the keel and off the wings so that they can breathe, and then you can put them back in their cage to recover. So we've got our little donut in our cage here, so it's just a little tea towel rolled up, and so she can sit there comfortably while she wakes up from her anaesthetic. Some of them might be quite awake with like Effie is, but others may just want to sit there. So we've covered a lot today in assessing seabirds in the veterinary practice. Seabirds are really great birds to have in care. You can learn a lot from them, and I hope you enjoy them as much as we do. We are very grateful to the Foundation for National Parks and Wildlife for producing this video. If you have any questions regarding treating our Australian native animals, please do not hesitate to contact the Byron Bay Wildlife Hospital at www.byronbaywildlifehospital.org.